So I'd like to welcome you to the Bengtson Center. My name's Dr. Brad Bengtson, and we are located in the wonderful, beautiful city of Grand Rapids, Michigan. We have an amazing practice, amazing office. We specialize in all aesthetic or elective procedures. The top procedures that I perform are breast-related, number one. Number two, more abdominoplasty, tummy tuck procedures, particularly a combination of those two together. We do about 150 combination breast abdomen procedures a year. And then number three, facial procedures, so like facelift, eyelid surgery, and that. Although we do the full gamut of all elective plastic surgery from head to toe. We have really top-tier technology, have lots of experience. Both Dr. Alfonso and I have been doing this a long time, really on the cutting edge of technology. And so we really want to provide the best technologies, techniques, procedures for our patients. So that's what you'll experience here at the Bengtson Center.
Hello, everybody. My name is David Alfonso. I'm a board-certified plastic surgeon here at the Bengtson Center for Aesthetics and Plastic Surgery. My areas of expertise in cosmetic surgery include facial rejuvenation as well as breast and body contouring. We're very excited about the opportunity to educate and talk with all of you today about some of the nice advances in technology which have helped to make surgery and recovery much easier for our patients. So many of you may have heard the term Mommy Makeover. It's sort of a generic term, but really it describes the opportunity for women who are done with pregnancies and having children to help rejuvenate the two most common areas of concerns. That would be the breasts as well as the tummy area or abdominal area.
When children come into the world, they are the most amazing thing imaginable, right? They wreak havoc on women's bodies. And so the challenges and stuff that are created with breastfeeding or even not, weight gain, weight loss, those sorts of things. In the abdomen, obviously, there's a lot of changes in that happen to the abdomen with babies, weight gain, weight loss, and that. In the breast, what can happen, the breast tissue, soft tissue can stretch. Usually after the second or certainly the third child, there's enough skin stretch where we have to actually do a breast lift or remove some of the skin as well as replace some of the volume that's lost. In the abdomen, what happens is the baby and the intra-abdominal contents increase, and the fascia, which is I call the cover of the book, kind of stretches out towards, outward away from your body. So the diastasis, that's a real common word that people talk about. It's not a separation of the muscles. It's a stretching of the fascia, which is the cover of the book. The muscles are the pages. We don't really care about them. The muscle just kind of thins and responds, but it's that fascia that stretches out that we want to get back in alignment. So commonly in the tummy, we're actually bringing the fascia back together 4 to 6 inches. And then typically in a full abdominoplasty, taking all the skin from the belly button all the way down to below the C-section line or the suprapubic line. So a mommy makeover classically is doing those two procedures together. They typically take about an hour and a half for the breast, about 2 hours, 2.5 hours for the tummy. We have kind of limits of about 4.5 hours for surgery at one point in time. And so we can combo those two procedures that go really well together. They're less expensive to combo things together. The recovery is the same. So it just makes a lot of sense. So mommy makeovers, by far and away, the most common combination procedures that we do.
Most women who come in and want to talk and consider this procedure do so because they feel like they've lost a significant amount of volume in the breast area. In addition, oftentimes their abdominal muscle wall, called the abdominal fascia, has been stretched out with multiple pregnancies. In addition, many of them have loose hanging skin. So the tummy tuck procedure is the ideal way to reshape the abdominal area tighten the skin as well as the lower or deeper muscle area. In regards to the breast, it typically involves adding volume, which has been lost through the process of pregnancy and breastfeeding by using an implant. And for some women that aren't interested in more volume, but rather a lift, I can use their natural tissue, reshape it, and reposition it to give them a much perkier and better positioned breast. So a lot of patients have heard the term tummy tuck or abdominoplasty, but may not know exactly what this entails. This procedure has been around for many, many years, and we've refined it quite a bit over the last few decades. The procedure basically involves tightening the deeper abdominal core layer, which can be stretched out in many women who have had pregnancies. This helps to create a flatter and better contour to the abdomen. In addition, it helps to remove excess skin from below the belly button. Oftentimes, that's where many of the stretch marks accumulate in women, and it's very effective at removing the excess skin in the lower abdomen. It does leave a scar in the lower part or below the bikini where most women would wear a two-piece bathing suit, and typically around the belly button. We take extra care in closing the incisions all over so that patients have the best scar possible and can be out in a bathing suit when they've recovered and have very little idea that anybody would know that they've had surgery.
In plastic surgery, it's all about proportionality. So if the nipple is below the fold, so the inflammatory fold is the crease under the breast, that's really the foundational point of the breast. So when you're sitting or standing, if your nipple is below that fold or crease, then we need to lift the nipple up over the fold. Some patients, even after having 2, 3, 4 kids, they're blessed with really good skin, integrity, and their nipples still are above that fold. So in those patients, we would just do a straightforward augmentation. Some patients have extremely, stretchy skin. I had a patient came in the other day, and her 4-year-old daughter asked her when she got out of the shower, "Mommy, why are your boobs so long?" So those patients, they need a breast lift, right? So it's a combination of breast procedures, either reduction, a lift with an implant, just a straight lift for patients that have good volume, or an augmentation in patients that have had volume loss.
In many patients who come in for an abdominoplasty, we end up discussing the benefits of including liposuction with their procedure. Because for most women, it's a combination of excess skin, which the abdominoplasty or tummy tuck improves, and also extra fat pockets that are not necessarily amenable to weight loss. Where those tend to be most common are the inner and outer thighs, as well as the hip or back area. Very often when I do an abdominoplasty surgery, I combine liposuction, which involves very small incision, about a few millimeters in size, and removal of fat. So no skin is removed with liposuction. We're relying on patients' own skin quality to shrink down and have good shape and contour as time progresses from their surgery. It's a great way to enhance the result from this procedure and combine the best of both modalities, surgery as well as liposuction.
So one of the exciting things that we have to offer here, when my wife and I were first designing the practice, we went all over the United States, Europe, Scandinavia, looking at some of my friends and colleagues' practices to really provide and build a very unique concierge-based practice. And the surgical center is by far and away the nicest operating room facility that I've ever seen. We have just striker showrooms. We have the top quality of every technology. The anesthesia staff is amazing. We have about 15 of the best anesthesiologists from Spectrum rotate through our practice. Some of them do the heart-lung transplants, bypass operations, run the ICUs. They're all amazing technically, but they're also super great people and really fun to work with. So we really get to hand select the best anesthesiologists, all physicians that work out here. Our nursing staff is incredible. All we do is aesthetic surgery. So I always tease them and tell them, you should be good. We only do like 12 things, right? So we only do like 12 different types of operations. Obviously, every patient's unique and brings different, things to the operation, but it's not like we're doing ENT surgery and orthopedic surgery and neurosurgery. And so the nurses have to, know how to take care of 3,000 different operations, right? So we just do the same thing repetitively over and over and over. And we also have the ability to operate on really healthy people that want to be here. And that's a really big difference than the hospital. So the anesthesia team's outstanding. The nursing staff is just really incredible. You'll have a really tremendous experience here.
So one of the important things that we discuss with patients is picking the right surgeon based upon experience and credentials. In our surgical facility here, we have an accredited center. We use all board-certified anesthesia doctors who are excellent physicians. They're with you the whole time that you're asleep under general anesthesia. In addition, we do a lot of things here unique to our practice. First and foremost, our anesthesia doctors are trained in doing pain blocks. It's called a tap block. And that's done while patients are asleep to help with the post-operative pain control. In addition, we have embraced the rapid recovery techniques that have been described in outpatient surgical literature, which involves starting medications before surgery in order to minimize the amount of pain medications afterwards. With the combination of these factors and the advanced technology, including a recent acquisition, which we're very excited about, called LipoAI. This is a laser-based liposuction machine, which helps to get improved skin tightening and has created a great opportunity for patients to get improved outcomes when they combine liposuction with their tummy tucks. All of these factors combine to offer our patients what we feel is the premier experience and the best recovery possible after a cosmetic surgery. So in order to achieve success for our patients and great cosmetic outcomes, it really is a team approach. When you come to your consultation here at the office, you're going to meet our FIT team, which is our first impressions team at the front desk, who will greet you warmly and make you feel very welcome. In addition, you'll meet our clinical staff, our nurses and MAs who will help educate you about the procedure and answer questions, as well as, of course, myself and Dr. Bengtson, which we will provide opportunities for you to ask questions and hear our philosophy and our recommendations for surgery. In addition, we have a great team of schedulers who will talk to you about how does scheduling work, as well as the finances involved with surgery. The day of your surgery, you'll meet our incredible staff and team at our New Vista Surgical Center. These are the nurses and the anesthesia doctors who will meet you, talk with you, get you prepared for surgery, as well as provide you the best care possible afterwards when you're here in our recovery area. We take pride in having great teams that are focused on patient care and achieving great outcomes.
There are a number of things we do differently here at the Bengtson Center that are very unique across the United States and even the world, to basically make the patient the most comfortable, the best possible outcome with the least number of complications or problems. When we start with the breast, there are 4 or 5 things that we do that are really significantly important to get the best outcome for those patients. So the first thing we do is we have a simulation system called Vectra. Actually helped Doug Canfield develop the system, and we can actually simulate different implants inside your body. Very accurate, and it really helps getting patient implant selection and implant selection. I always tell patients it's a little bit like that Price is Right game. Has the fridge at $695. That red bar is going across, and you want to bang the button when you get in that range. When it comes to breast implant selection, we need to be in a certain range that fits in each patient's body. And so the simulation really helps for patients to visualize what that looks like, and really decreases the need for implant size change. We used to do a lot, probably 30, 40 patients a year. They were just not happy with the size. Now I haven't done a size change operation probably in 10 years. So it's virtually eliminated that. We want to make sure we're on the same page when it comes to implant selection. And so we spend a lot of time educating on that. At the time of surgery, we do the surgery typically through a lower fold or crease incision. It's a little over an inch, and there's not one drop of blood. So when you do the surgery completely bloodless, there's no trauma to the tissues. There's essentially no bleeding, no bruising, minimal swelling. The muscle doesn't like an implant underneath it, but there's very little swelling. And so there's much quicker recovery. We have patients actively move their arms above their head, starting right in the recovery room, kind of stretching and moving. We want you to go home, take a nap, and then the vast majority of patients feel good enough to get up and go out to dinner, at least feel good enough to go out to dinner without narcotics. So that's our routine or standard. And then the last thing that we do that is critically important is following breast patients with ultrasound. So gone are the days, our expensive MRIs, $3,000-$4,000 MRIs to check silicone implants inside the body, or randomly replacing implants every 10 years. Starting about, usually about 2 to 3 years after surgery, we will have patients come in, talk about their new dog in their new house, and just scan their implant. And the new implants, fortunately, the way they're manufactured, I think they're going to last 30 years or longer. There's very minimal wrinkling and rippling. They're super strong. I ran over some with my Ford F-150 about 4 months ago, and they didn't break. My son thinks he's a movie producer now, taking that video. So they're super strong. They're going to last a very long time, but we like to see the status of the implant. So we're presenting actually at our national meeting in a couple months with our experience, by far and away the largest series in the world looking at breast implants inside your body. So it gives patients a great just sense of security to know, hey, my implants are looking good. And then for patients that have had implants from prior generations, 10, 15, 20, 30, sometimes actually 40 or 50 years ago, those implants need to be checked. And we can check those with ultrasound with more than 99% accuracy. So those are some of the exciting things that we do here at the Bengtson Center that are quite unique in the breast. So Dr. Bengtson from the Bengtson Center, thanks so much for tuning in. Dr. Alfonso and I will be around and available to answer some questions live. Scoot it a little bit.
Okay. All right, go ahead, Dr. B.
Hello, thanks for joining. I hope you enjoyed those little vignettes. Dr. A and I are here available to answer some questions, and so we'll just kind of go through some of those. First, we wanted to make sure we offer those that are attending 50% discount on your consultation. And then we also apply the surgical consultation fee towards your surgery for those that elect to have that. So excited to see you live here at the Bengtson Center. So a couple different questions. One, we didn't really get into recovery in detail. The recovery has really changed very dramatically over the past few years, where we're actually doing tap blocks. Our anesthesia team uses our ultrasound system to basically numb the nerves up that go to the abdomen. And so for 2-3 days, patients have a marked reduction in pain. They're able to get up and ambulate, walk more, less blood clot chance in the legs, less pain. So you're less groggy, less constipated with pain pills and all that, able to get up much more and be much more active. For the first few days, you need some help. Everything's kind of in slow motion. You're kind of getting up to the bathroom, but we have patients get up and walk every 2 hours, starting day 1. You can sleep all night, but we really want you up and active. Usually day 4 or 5, you're kind of getting up on your own, doing a lot more activity. Come in on average about day 9 to get the internal closure device and Thierry out. And then basically just kind of fold back into normal activity. I typically tell patients about 4 or 5 weeks before you're kind of doing routine everyday activity as you were preoperatively. Okay.
All right. Hi, everybody. It's Dr. Alfonso. One of the questions that we got, which is fairly common, was what happens if I have a hernia? Hernias are relatively common, especially in women who have had pregnancies near the belly button or umbilicus. And if they're small hernias, then we typically fix them as part of your surgery. We don't participate with insurance, and so there's no billing that would go to insurance or insurance coverage for that. Sometimes we find patients before surgery that have really quite large hernias, if they're from a previous surgical incision or other areas. Those typically we recommend they get fixed by a surgeon who specializes in that, typically a general surgeon, to help those get fixed before we do body contouring procedures. Because it's better that get fixed the proper techniques that they use for large hernias. But it's pretty common that we find small hernias around the belly button. Those are easily fixed by Dr. B and myself when we find them in surgery, and they're very rare that they come back in the future. So that's something that patients oftentimes will ask about. One question we've also had in the past is, can I get a tummy tuck with my last C-section? The answer is pretty much no, for a variety of reasons we don't have to go into, but we want you to focus on getting through one surgical procedure, which is completely different than what we do after patients have lost the baby weight and things like that. Typically, we like to tell patients to wait until done with kids, and that way their bodies are better off tolerating a surgical procedure, because we recommend not getting pregnant after a full abdominoplasty or muscle repair type of abdominoplasty to maintain the results over time.
Cool. Thanks, David. So another common question, these are actually really, really good questions, guys. So really common question is timing. So with the breast, we like to be done with breastfeeding at minimum of 6 months. Typically a little bit longer is beneficial. It takes a while for the breast to kind of normalize in size, and it's very common even up to a year to run into some milk ducts and stuff like that. So we want to make sure that you're back to baseline. Another really common is as far as like weight loss, with abdominoplasty. So I tell patients this is the biggest procedure that we do. You really want to be pretty basically at your ideal body weight, or this is as good as I get sort of a weight. Particularly if you've lost weight significantly, we recommend that you really kind of normalize and are really happy with your body weight size proportion. 5, 10, 15 pounds even doesn't really matter a lot. You can kind of bounce up and down from that. But if we do your surgery before you've actually achieved your ideal body weight, first of all, it's a little bit of a myth that, I can do surgery and then it'll kind of jumpstart me to, basically lose more weight. That really rarely ever happens. We kind of actually do the opposite. We tend to kind of escalate back up to our preoperative weight. So you do want to be, closer to your ideal body weight, before you have the procedure. But again, if there's a 10 pound, 15 pound fluctuation, it's not really going to dramatically alter things. But the farther you are away, or the more changes that happen after surgery, both in the breast and abdomen, then we may need to do a revision, removing more skin, not as extensive as the first major operation, but so that's the scoop on that.
All right, a couple more questions kind of rolling in now. One of them was, can a fat transfer to the hips be done with the tummy tuck? The answer is yes. Fat transfer is a pretty popular procedure these days. The two most common areas that we find ourselves doing that for patients are into the buttock area, and also what we term the hip dips, which are sort of the side of the buttock as it goes around, where women are trying to fill that out. For the most part, it's a procedure that can be combined. We're always mindful of how long surgeries are going to take, and we don't want to do any type of a procedure that's going to go beyond a certain amount of time in the operating room. Whether it's combining breast surgery with a tummy tuck or other areas of fat transfer, it is a procedure that we often do here because patients are interested in getting as much body contouring done as they can in one setting while still maintaining very safe standards.
So super great question as far as the significance of surgery, like how much of a lift do I need to do? How big of a C-section do I need to do? Repair or abdominoplasty. So when it comes to the breast, again, as our prior presentation, we look at the nipple position based on the inframammary fold location to determine how much of a lift we need to do. And so if it's just like an inch below the fold, then we can usually just do an around the nipple lift. If it's more extensive than that, then we need to go more. When it comes to the abdomen, we look at what mainly the concerns that the patients have, and then also what is the challenges that we face. So if you are very fit and you have a C-section, we can actually just do a little mini tummy tuck where we're just really kind of revising the scar and removing kind of an ellipse of skin, probably 3-4 inches high, and just getting the skin kind of realigned to itself so it decreases that overhang. If you have a lot of laxity of the abdominal wall where the muscle is really stretched like we talked about, or a lot of weight loss previously, a lot of extra skin, we essentially have to do a full abdominoplasty. As long as we keep the scar very low, the incision is very, very low in the abdomen, we maximize and remove every millimeter of skin that we can. So we're typically taking, sometimes 6 to 12 vertical inches of skin out, and to improve the contour and tightening up the muscle fascia, again, to get a flat abdomen. It really requires a full abdominoplasty. We have to get full exposure to the tissues to get the best outcome.
All right, let's take a look at some of the new questions that are coming in. If you don't need muscle repair, is it a quicker recovery to a 360-degree surgery? So muscle repair is done pretty commonly, but not 100% of the time. There are scenarios in patients who have either not had any pregnancies or have maybe had one pregnancy, or certainly in male patients that have not had the stretch to their abdominal fascia, where we can do a body contouring procedure where the muscle repair does not need to be done. And it definitely can enhance the recovery, because typically the muscle repair tends to be the area that causes a bit of the soreness in the front part of the abdominal area. But we also want to make sure that we're not completing the full procedure, meaning that we want to do what's right for the patient and get the best result. So even though the patients might feel like, well, my muscles are kind of stretchy, but not too stretchy, I really, don't want to be having a longer recovery. The problem is if you try and take a shortcut and not treat the muscle the way it should be, you're going to be left with a not great aesthetic shape to the abdominal area, with more likely some bulging over time. So every patient is unique, and we don't do cookie cutter surgery. But for the most part, for most patients who have had multiple pregnancies, at least 2, if not more, it's pretty rare that we do a surgery like this and don't repair the muscles.
Cool. So really good question on asymmetry. So commonly the breasts are very asymmetric. One of my favorite mentors used to always tell me that breasts are sisters, not twins. So we actually communicate that to patients all the time. We're going to show you that your nipples are not in the same position. With our vector imaging, it's really pretty amazing where we can actually show volume differences and stuff between the breasts. So we're always trying to get better symmetry of the breast. Probably 70% of the time, I'm using a different type of style or volume of implant to try and gain better symmetry. But the way to think about it is essentially we are drawing lines down from like the sternal notch down to the nipple. So we need to get that upper pole of the breast, the sternal notch to the nipple, the distance equal on both sides. We need to get the nipple to the fold distance the same on both sides. And we need to try and get the volume of the breast the same on both sides. Sometimes there's a little bit of shape differences and stuff in the breast that the volume we can get really good, but there's a little bit of asymmetry that provides some longer lasting sort of asymmetry. But we'll educate you on what's possible and what's not. But we're very commonly doing a lot of differences from one side to the other when it comes to the breast. Just kind of the last question, unless there's some other ones that come in on fat transfer. I know David talked a little bit about that. We transfer fat all over the body. So we do facial fat transfer for patients that have hollowing, particularly of the cheeks. We do a lot of breast fat transfer, and then also kind of liposuction irregularities, kind of lipo gone wrong cases and revisional patients we do, and then also BBL or buttock augmentation. So the important things to know about fat transfer are it needs to be safe. And so we only put fat into the fatty layer. We don't put fat deep into the buttock area or deep into the breast. In the breast, we don't want to put fat into the muscle or into the breast because it can confuse radiologists and look like a breast cancer. So it can kind of create calcifications and be confusing. So I want to know if I put fat in somebody's breast that I know that I put it there and it's very superficial and it's really easy to remove. I've actually not had to biopsy a breast or, for a question of a cancer, but I want to be able to reassure the patient that, that's the case if it is the case. So it's super important. Fat also is we're not at the point where it's an implant substitute. So unfortunately, some patients come in, they're like, I just don't want an implant to deal with it, and follow up and all those things. Fat, we can't put enough fat into the breast safely to be an implant substitute. So the way to think about fat is really more of as a thickener. So a lot of revisional patients or just naturally patients will have a lot of asymmetry of the skin, and the thickness will be really thick and then very, very thin. So we want to put fat in those areas where there's thinning or implant rippling and wrinkling. Those sorts of things are super helpful, for fat. In the buttock area, it's super important not to put fat deeply into the muscle because there's some very large veins that are there, and the fat can actually go to the heart and it can be a fatal event. So obviously, I always tell patients, we're only going to put fat where fat is safe. I'm a big scuba diver, my wife and I, and kids. And just like scuba diving, surgery is a two-way trip. You got to come back to enjoy it. So, that your safety is the ultimate, sort of importance thing for us. And down in Florida, they've actually had, you may have seen on the news, a lot of mortality with fat transfer. So now they have limits on how much you can get, how many procedures can be done a day, because it's kind of a factory down there in some places. And they're even requiring ultrasound to make sure that the cannula is in the right spot so that you're not potentially introducing fat deep into the muscle where the veins and stuff can cause problems. So we do a lot of fat transfer, but also we want to, make sure it's safe. About 50% of the fat that we transfer survives. So we tend to overfill things a little bit, except in the face. We don't, because the blood supply is so strong, it really, creates good vascularity in that. So, I think those are the main questions that you guys submitted. We're going to actually look at all the different questions, and the people who signed on that have given us emails will actually respond to the questions in writing and kind of get that information back to you. So really enjoyed it. I hope it's been informative and helpful. Look forward to seeing you guys at the Bengtson Center, and definitely let us know if you have any other questions or suggestions on how to make this event better, more frequent. Thanks so much for joining.
Just smile and wave for a second.
Okay.